appreciated your books over the years, and thank you for them. I wanted to go back. You made a quick allusion to what's going on currently in this country regarding the Ebola scare. And the Texas Presbyterian Hospital, which was allegedly a very fine institution, made some mistakes. We don't yet know the details of that, but there's a sense that things didn't go well. To what extent is there an egocentricity about physicians caring for patients, especially specialists, who feel they're at the state of the art, they know what there is to know, but possibly don't know what they don't know? To what extent did that hospital and its staff not know what they didn't know?
The unknown knowns.
As you say, there's a shadow of Rumsfeld round in this one.
Here's the thing that has struck me about the difficulty in being able to get all the steps right with containing an Ebola virus. The steps have been standard public health infection control measures that have been around for a very long time. They mostly involve knowing how to isolate people effectively. The isolation doesn't require fancy rooms, it just requires a room with a closed door. It requires wearing some gloves and gowns and a mask. That for 40 years of containing multiple outbreaks of Ebola, it hasn't required high-tech hazmat suits and respirators. But the fundamental breakdowns and the really basic things like how you take a gown off without contaminating yourself is knowledge that we haven't had. And how do we know that we haven't had it? And how do we know that that Texas hospital is no different from others across the country, across much of the world? The answer is that 2 million people a year pick up infections in our hospitals in this country and many more in the world over, mostly because of our inability to follow those basic infection control practices. And our inability to do that mostly reflects our lack of recognition. Now that with Ebola, suddenly we can die. It's like the pilots who, if they don't get the procedures right, they can die. When we were the vectors of transmission, the SARS virus, when that outbreak happened half a decade ago, 10,000 people were killed within weeks, and it was almost entirely passed by healthcare workers. We did not have this same kind of outcry, even though it was the same kinds of issues about basic hygiene and control. And so, I think this is less about the unknowns and much more about that sense of, we are resistant to the detail. Ironically, when I go into an operating room, we know exactly these details.